I'm Kristen Wallman, and today I'll be sharing my research examining parent empowerment in a caregiver-focused peer navigator autism intervention. That's a mouthful. Okay, first, the information, contents, and conclusions of this presentation are my own and not those of Lens supporting organizations. This research project is focused on an emerging and promising parent-focused intervention approach that's often called family navigation or sometimes autism parent navigation. The project utilized research from a randomized controlled trial of one such parent navigator intervention called the Mind the Gap parent-focused peer navigator intervention. I'll spend a few minutes talking about that program and the trial. Then I'll discuss my research project, which employed quantitative analysis to test a prediction, namely that weekly interactions with a peer navigator parent coach in the Mind the Gap intervention would increase self-rated empowerment among parent participants. So just a little background, parents are often highly motivated to support their children when they receive a new diagnosis. However, in their efforts to maximize positive outcomes for their child, parents confront many challenges and barriers. Parents often feel a sense of urgency to access services because it is now widely known and recommended that children beginning appropriate autism services at the earliest age possible have better outcomes. Some of the challenges parents encounter include attending to the often complex needs of individuals with autism, learning about their child's complex neurodevelopmental condition, becoming an adept co-provider of parent-mediated interventions, navigating a maze of disparate and complex service systems, and developing advocacy skills to acquire those appropriate interventions. Members of historically underrepresented and under-resourced groups face added barriers to accessing diagnosis and timely interventions for autism. In fact, research indicates later diagnosis among this group and access to fewer services among this population of parents and caregivers of children with autism. In the face of these challenges, what can be done? Emerging research indicates that strategies designed to support families in accessing services increases parent engagement and also leads to improved outcomes for children diagnosed with ASD. The Mind the Gap peer navigator parent intervention incorporates these strategies. So what is the Mind the Gap intervention? Well, a randomized controlled trial of Mind the Gap intervention recently concluded, and my research utilizes a small portion of that data that was collected during the trial. Some details about the study population and design are that the study was 12 weeks long and included at the outset 118 parenting caregivers. 4 study sites across the US participated. It was Los Angeles, Philadelphia, Sacramento, here at the Mind Institute, and Rochester. Participants were selected using a participatory research method. Children had to be 8 years or younger and could not already be receiving specific interventions targeted for the treatment of autism. Participants' families' household income had to be below 250% of the federal poverty level. So this is what the design looked like. In the trial, participants were randomly selected to either the control arm of the study, in which they received access to online training modules covering the topics you see listed here, or the treatment or intervention arm, which included the same access to training modules, but with the added facet of weekly contact with a trained peer coach who offered support and training and guidance in seeking services. Okay, so here's my research question. Now that we understand the barriers parents often encounter with a new autism diagnosis, the goals of the Mind the Gap program, and the framework of the Mind the Gap trial, I'm going to describe the research problem I'm addressing, my research question, and the analysis I did for my project. So the research problem I identified is that it's unclear precisely which components of parent-centered navigator interventions like Mind the Gap are impactful. So I analyzed data from the Mind the Gap randomized control trial, empowerment data that they completed at base and post, and participation data were analyzed. Specifically, the project explored the relationship between participation in the Mind the Gap intervention and self-rated empowerment among parents in the trial. Okay, so just quickly, empowerment is generally understood as a practice approach, but also a theoretical concept that characterizes empowerment as an individual's possession of knowledge, confidence, positive beliefs about one's strengths, self-efficacy and capacity, and one's ability to set and accomplish goals, and exert influence and control over their own lives. So, right, this is what we want parents with kids on the spectrum to be able to do so that they can access services. Okay, so research indicates that higher empowerment is associated with characteristics in parents that can improve their ability to support their child with autism. In addition, a reciprocal relationship has been found between parent engagement with accessing services and so forth, and empowerment. So the higher the empowerment, the more able they are to access interventions and be engaged. So the Family Empowerment Scale is a tool that was used among several other research instruments in the Mind the Gap trial, and that were solicited from parents at the beginning and post. Okay, so my first analysis was looking at participants' self-rated empowerment, and I compared the control group, remember, which received only access to the training modules, with the treatment group, which had the added element of trained peer coach. And here is what I found. Using a paired sample t-test, self-rated levels of empowerment, which are on the y-axis, of both the control group in blue and the treatment group in the orange, both groups increased significantly from baseline to post-treatment, which is exciting. So only having access to the modules was empowering significantly, statistically significant for both groups. So after looking at that, I looked at participation in peer coaching, and I divided up 3 groups. So the first group was the control group, and of course they did not receive any peer coaching because they were the control. And then I broke out partial participation. So any parent participant who attended from 1 to 10 sessions with a peer coach was in that group, partial, and the full participation was anyone that completed 11. I think there were a couple of outliers that completed 12. So we called that full participation. All right, and here's what I found. Interestingly, changes in empowerment increased statistically significantly for all 3 groups, which is really exciting. So you didn't have to do all of the sessions to increase your empowerment at a significant rate. However, the highest coaching session attendance, so the parents who attended the most contact sessions, weekly contact sessions over the 12 weeks with their parent coach, did in fact have the highest empowerment. And that's really exciting. So what does that mean? Well, based on the findings, it appears that weekly interaction with a trained peer coach significantly increased self-rated empowerment post-participation in the intervention. In addition, the more the participant engaged in weekly coaching sessions, the higher their self-rated empowerment. Thus, the peer coaching element of the Mind the Gap parent intervention was a significant mechanism, remember that's what we were looking for increasing parent empowerment among the treatment arm of the study population. So future directions, it appears that culturally matched trained peer navigators are a core mechanism in a multi-component intervention for increasing empowerment in parents of children with a new diagnosis of ASD. Continuing to identify other core components is important for advancing the rapid dissemination and scale-up of parent navigator programs for families with a new ASD diagnosis. And that's important because there are a lot of families who want parent navigation and need parent navigation because of the complex barriers that they face. And finally, further analyzing and refining the core components of the Mind the Gap intervention may advance its utility in community settings. So that was my research. And I would like to acknowledge Dr. Samer for her mentorship, Robin Stewart for her supervision and my internship at the Mind Institute, my amazing LEND cohort colleagues for the engaging and thoughtful discussion that we've had throughout the year of LEND. Also to the AirB3 network for allowing me to use their data, and to the Mind the Gap parent coaches and trial participants who made the research possible. And of course, the Mind Institute and LEND training program. Thank you. And I see that we have time for questions.
Thank you, Kristen. We do have one question that came in over the chat. Abby asked, other than peer coaching, what are the core features of the FN program?
Well, that's a good question. So interestingly, there's some research being funded by Autism Speaks that is looking at the core features of Family Navigator programs for autism. And they identified, I think, 11 features, but they grouped them into 3 domains. And the 3 domains were training for coaches and ongoing supervision for the coaches that are working with families, Navigator tools, so like online modules and binders and access to information. And the third domain was Navigator activities. So that was the relationship and social and support between the coach and the family, and the care coordination that they provided. So those are the 11. There are 11 that were identified, and those are the core ones. And I can say that the Mind the Gap incorporates all of those. I just happen to focus on the peer coaching. And one of the reasons, I won't take up too much time, but one of the reasons I focused on that is not only because I'm a parent coach and have been for a long time, even though I didn't know what I was doing about 15 years ago when my own children were first diagnosed as neurodiverse folks.
I have a question, Kristen. You said that you looked at the data of the parents who attended 1 to 10 sessions and then 11 or 12?
Yes.
That seems very close, especially the ones that are 10 and 11 and 12. How did you pick those points? Was there some kind of reason?
You know, that's a good question too. I went around and around with it. And this is actually my thesis research as well for my master's degree. And my thesis advisor recommended this. He specializes in statistics, and he felt that it would be better rather than, so we can take the control group out, obviously, but it seemed to be, so there were, let me say it a different way. When I broke it out this way, it was almost equal. So there were 25 parents who attended some partial and 20 parents who attended 10 to 12. And so even though there were some outliers in that 10 to 12, they tended to sort of group together in the middle of around 6. And so it didn't seem to make a huge difference if I made it, 1 to 5 and 5 to 12 or something like that. It just, I guess the answer would be, after looking through the data, it just seemed to make sense.
Okay, thank you.
Yeah, this is not my area of expertise, but that was the rationale.